Good afternoon, everybody. This is Dr. Jeff Culbert from Schooley's Mountain Chiropractic Center. Today, we're going to do a little bit of a discussion conversation video, and hopefully you'll find this very enlightening and inspiring to either give our office a call, come in and visit us, or at least check out to see if there's a chiropractor near you who might be able to help you with some things. Now, in the past, we've talked about that the vertebral subluxation, or the bone that goes out of place, is generally the result of stress. And chiropractic has been known throughout over 125 years that our primary focus and our primary goal is to eliminate the cause of the problem. And chiropractic always has gone from the standpoint that the cause of the problem or the cause of the symptoms is always going to be tied into a vertebra that has misaligned within the spine that's pinching the nerve to create the symptom, whether that symptom is going along a muscle, a joint, an organ, a gland, or something going on with the skin, giving you some aberrant function which creates your symptom. Your symptom, as I always equate it to, it is the sign that something has been going wrong. And sometimes that something that has been going wrong has been going on for a rather long time. Your body has the innate ability to start to adapt and accommodate to the situation that is creating the symptom that is going on. Sometimes it's just a faulty posture, just like cradling the phone and talking with the phone held between your ear and your shoulder. And for a long period of time, your body can compensate and deal with it, and then all of a sudden it says, I can't do that anymore. So that is a sign of a physical stressor that's creating that. We also know that there's plenty of things that go on in this world today that are emotional stressors as well as biochemical stressors, such as are we taking enough vitamins or not? Are we getting enough water or not? Are we eating enough fruits and vegetables? You know, the whole thing goes on is, what's going on in our biochemistry, whether that's stuff that we are consuming, that is vitamins, that is medications, that is just things that we are exposed to in the air. So when you look at it, ultimately what is creating the subluxation is some form of stress that has been building over a long period of time, or in the case of something that is traumatic, it happens instantaneously. You know exactly the cause of the problem. You fell down the flight of stairs, you were in a car accident, you fell off a ladder, whatever that trauma might be, you know exactly the moment in time when that occurred, and you obviously know how to avoid it. The bigger problem and the bigger question that we have is, if we are going to get to the root cause of the subluxation, we need to start to address some lifestyle factors and what are the subtle things that are going on, not necessarily in an instantaneous moment, but those things that are accumulating that stress, physical, emotional, or biochemical. All of this stress starts to play on a little group of organs sitting on top of our kidneys called our adrenal glands. Our adrenal glands are supposed to fire with adrenaline and have us meet and conquer the challenges that are going on in our lives emotionally, physically, or biochemically. Unfortunately, with the constant overload of stress that we have in our society today, and the fact that most people are not doing all of the things, such as exercising aerobically, drinking lots of water, eating plenty of fruits and vegetables versus refined foods and junky foods, they're not getting nearly enough sleep, they're not watching their posture, they're not maintaining their attitude. Only about 12 to 14% of the population as a whole gets adjusted, especially adjusted on a regular basis. So by far, there's not enough people getting adjusted. And what ultimately happens is, as the stress overloads, much like a circuit breaker in your house will overload with having too much electricity flow through it. And then the circuit breaker trips. And you've got to go and figure out, is it a reset button that you got to reset? Is it a circuit breaker you've got to go and switch? And as a chiropractor, we are looking at where is the vertebral subluxation and how does that relate to the symptomatology that is going on in the body. And to the degree that we find the right subluxation, we adjust that. And then the degree that we can work together as a team and try to figure out what are those lifestyle stressors. Is this particular subluxation coming just from a stress overload that's more physically oriented? How you cradle the phone, how long you sit, the exercise that you're getting or not getting, you're slouching in a posture versus sitting up straight, tend to frown more than you smile. All these things, are examples of physical changes that our body has to adapt and accommodate to, and sometimes take a break from. Are we doing that? Or is it a biochemical stress? We constantly are eating the wrong foods. We don't eat breakfast at all. We're eating too many white flours and sugars and starches that our diet is not conducive to producing and allowing us to digest and absorb and assimilate the vitamins and the minerals that we need for healthy teeth, bones, muscles, and organs that function properly. Or is it a constant stress overload? Are we always on our cell phones or our devices? And along with that, is our posture held forward? Are we constantly listening to the news without taking a break and watching something that is comical and more relief? Are we watching more reality TV shows that are always seeming to be bent on somebody has it worse than the guy next to him, okay, and who's cheating on who and all of this type of stuff? So is it more that we are emotionally overloading, or is it a little bit of a combination of a little bit of the physical, a little bit of the emotional, a little bit of the biochemical, and we have to start making changes. And the one thing I've learned about people as a whole, people are often resistant to change because change always brings the fear of what is the unknown. And is this going to work? Is this going to be beneficial for me? And how long am I going to have to do it? Is it a short period of time? Is it a long period of time? There's just so many variables of change that go on that people, when they don't have a definitive answer, as opposed to blind faith and trust that there is a process that goes on, that the body will begin to heal, and we have to start finding out what are these circuit overloads that keep tripping the subluxation in our spine that pinches the nerve to affect the muscle, the joint, the organs, the gland, or the skin to have some aberrant sensation that ultimately brings you into a doctor's office, whether that's a physical therapist, a chiropractor, a DO, an MD. You're always 90% of the time, 95% of the time going in because there is a symptom driving you in. And the next thing that is going on, because very few people will go in just, I want to be well and stay well, okay? It's always triggered by something generally. The next thing is to realize is just because the symptom goes away does not mean that your body has typically healed enough. You know, when a symptom comes on, it's generally because there's something going on that's creating an aberrant sensation, such as an inflammation or a swelling that's going on, specifically in case of a muscle or a joint. With an organ or gland, it has decreased function until there's enough congestion and clog within that organ that it swells and it starts to create a problem. If you don't believe me, just go out for a nice Italian dinner and overeat and stuff yourself. As soon as your stomach starts to stretch, you're going to know, okay, that that organ has been pushed to its max, and as it's stretching and swelling, it's stretching nerve endings that are creating the symptoms. So once the symptom starts to go away doesn't necessarily mean the problem has gone away. And just because there's no symptom doesn't mean that there's not a problem brewing. Okay, so first we got to recognize that symptoms are only a warning sign or a signal. But just as you're driving along in your car, you know, sometimes you're going along just fine and there is nothing going on, and all of a sudden the warning light pops on. That is your symptom. Okay, what's been going on that all of a sudden that symptom goes? Now you go in, you get it taken care of, and they can do one of two things. They can fix the problem, or they can cut the circuits to eliminate the symptom. So you really want to start thinking just as you do with your car. The light comes on, it's a warning, there's something not working right in the car. You go in to the mechanic and they go and fix your car. Now, no matter how long that takes or what's the cost, you find a way to be able to get that car to work for you and not have a breakdown, because it is a lifeline for you. It's what gets you to and from your home, to and from work, shuttles you from here to the grocery store, takes your kids to gymnastics or basketball practice. It is a necessity for you. But the other thing I want you to start to consider, that your body is a necessity for you. If your body is not working and functioning right, whether there is a symptom or not, your performance goes down. How effective are you as a person, as a mother or a father, as a teacher, as an employee? So it is incumbent upon you to know, is your body working 100% of the time? You know, we've co-branded now with the 100-year lifestyle, and their saying is 100% for 100 years. And I resonate so well with that it's something that I'm trying to communicate to all of my patients. You have a symptom, it has brought you into my office. We are going to go through a number of phases or processes in the office to resolve this problem and try to resolve it so it's not likely to ever want to come back again. So you come in with a symptom, go through a complete, thorough physical, chiropractic, orthopedic, neurological exam. Generally we'll take some x-rays, especially with a new person or somebody who has a problem that has been there for a while, so that we can determine, is there any disc degeneration or arthritis or anything else that might be going on that will complicate your picture as a comorbidity. And as we've come to learn during this whole crazy COVID time frame, comorbidities were a complicating factor that made COVID far worse for those people that had the comorbidity. In my experiences, most comorbidities, they will delay the process of your body healing anywhere from 1.5 to 3 times, typically per comorbidity. So if you're looking as a young person who might be delaying their care by 1.5 times, you have 3 or 4 comorbidities. It's 1.5 by 1.5 by 1.5 by 1.5. If you're an older person with a more chronic or degenerative process that's going on in your body, you may notice that your delay in progression or relief of symptoms and correcting the problem may be delayed by 3 times, by 3 times, by 3 times, by 3 times. And it's very easy to see where if somebody comes in with a problem the first time due to trauma, I might be assessing them as you have no comorbidities or you have 1 comorbidity, and we're going to be delayed. It should be within 2 to 4 to 6 to 8 weeks that we notice relief, and it might take 2 to 4 to 6 months to get the problem corrected. And then we can talk about lifestyle wellness care. That process may be delayed anywhere from 2 to 3 months, and it could be, depending on your age, you may be looking at a process that might take a couple of years to get it to the point where it's stabilized, and we can talk about long-term wellness and supportive care. So again, it's incumbent upon you to know that a symptom is a warning light. You're coming into our office to remove that symptom, and if you remove the symptom, it's like cutting the wire that I talked about with the mechanic. The car will still run for a little while, but eventually it's going to totally shut down. And it's not going to work depending on whatever that warning light was leading to. Sometimes faster, sometimes longer, depending on what that warning light was signaling for that car. So the same thing goes on if your body is looking for something to be corrected and you do relief care. Well, you need to know when you are ending the relief care, what are some of the things that you can do to delay the re-onset of this problem? Because the one thing I've learned, and it's statistically true, and it's backed up through years of research, that people who stop their care prior to relief 100% being done or at the time of relief will tend to repeat the problem within generally 3 to 6 months to sometimes as long as a year or 2. But when it comes back, it generally comes back a little bit worse than it was the time prior, and it takes longer to resolve on the back end. Those patients who recognize that I do want to get this problem relieved, and hopefully relieved as quickly as possible, but I don't want this problem to be returning anytime soon, will go through a process of corrective care. And during corrective care, not only do we continue their chiropractic adjusting, but we start to introduce exercises, generally basic stretches at first, and then those go to advanced stretches, and then finally strengthening exercises. And along with the exercise, we start talking about what are some of the nutritional supplements and support that your body is going to need. Is it going to be adrenal glands to help handle an adrenal gland system that is just constantly pooping out? Do you have weak ligaments associated with that overstress? Because when you're overstressed, there's a little reaction that has occurred that most people are not aware of, that your ligament structure will weaken by at least 1/3 to 50%, making you much more vulnerable for the spine or other bones to subluxate or misalign to create that pinch on the nerve that is going to result in a muscle, a joint, an organ, a gland, or the skin not functioning properly. So at that stage of the game, do we need to supplement with Ligaplex? Okay, is there something going on with a spot that's degenerative in the neck that's affecting the thyroid? Do we need to think of supplementing with thyroid supplements or iodine? Is it something that's going on that's menstrual? Okay, and we need to supplement for female support or male support through standard process. Do we need to run a Zytoscan to see what are the things that are going on nutritionally that need to be supported either by Medi-Herb or standard process, the 2 vitamin supplements that we utilize within the office? And from there, not only do we talk about nutrition, but we have to start talking about sleep patterns. The average person in this United States is right now getting on average about 6 hours and 15 minutes of sleep every single day. 100 years, a little bit more than 100 years ago, the average person was getting 9 hours to 9 hours and 15 minutes of sleep. Now, what happened to us in 100 years? Did we all of a sudden miraculously require less sleep? No, we didn't. We just sacrificed the amount of sleep we get to get more things done in a day. Okay, it was Edison who brought us the incandescent light bulb that got us into 8 hours, 8 hours, and 8 hours. But what we've started to do is we now have these things called devices. And these devices, whether they're a cell phone, they're an iPad or a tablet, they're a computer, it's your TVs, we now have access to all of this technology 24/7, 365. And we don't generally separate enough time for our daily activities. So if we're supposed to sleep 8 hours, work 8 hours, and get everything else done in our day within that additional 8-hour period, but as an average, the United States is roughly about 51 hours a week on their devices, okay? Again, whatever that device is, cell phone, tablet, TV, okay? You're on 51 hours a week. That's a little over 7 hours a day that we dedicate to device time. And now we're supposed to be working 8 hours, and we know with commute time or working and having a 9-hour day because we do 4 hours and an hour off for lunch, and then we have commute time. We're throwing in so much on our time schedule that to try to accommodate and get everything done, people are pulling back on their sleep, both on quality of sleep as well as quantity of sleep. And the thing that I can tell you the most after being at the National Sleep Institute a couple of years ago is the need for your REM and your deep sleep that helps you produce growth hormone. Now, somebody at my age is not producing growth hormone where I'm going to grow much taller or get much bigger or stronger. My growth hormone that I secrete is simply there for tissue healing and repair. So if you're looking for a more corrective and a wholeness and wellness oriented lifestyle, you're going to have to absolutely pay attention to what's going on with the amount of sleep that you're getting, let alone also the quality of sleep that you're getting. So normally I would be wearing an Oura ring. Right now that Oura ring is charging because I've depleted it and I need it to charge so I can know what's going on with tonight's sleep. But I also use a Fitbit, and there's also the Whoop bands that you can use to figure out what was my exertion during the day, what do I need to do in terms of quality and quantity of sleep so that I'm hitting 80, 85, 90, 95% sleep recovery so that you're producing the growth hormone that helps your body to heal and repair. The next thing you need to be focusing on, and we'll talk about and give you exercises and things that you can do, is always work on improving your posture. You know, one of the things through my chiropractic care and the working out that I do, at 63 I have pretty impeccable posture. And the amount that you maintain a healthy posture, whether you're sitting, standing, or lying down, simply reduces the stress that you put on your spine and your nervous system. You know, when you're sitting in a slouch position, you are recruiting muscles, and the muscles are working much harder than when you're sitting in a normal upright position and you maintain the normal curves of the spine, okay, so that your spine acts as a spring versus a constant compressive load coming down. And to maintain that faulty posture, you actually activate and trigger muscles to work much longer and much harder than they're intended to, just to maintain slouching and being in that faulty posture. And then it gets to be very difficult to I've got to exercise to strengthen these. Well, if I slouch, I'm in pain and I'm agonizing. And if I'm doing the exercises that I'm supposed to start maintaining a proper posture, well, those muscles are already weak, and to start to work them, especially for the length of time and the consistency that you need these muscles to work for, they fatigue out. And as they fatigue out, you start to get sore. So you're going through this constant battle. Yes, I want to work on good posture, but it gets achy to work on good posture, so I slouch. When I slouch, after a while it starts to hurt, I work on and you're constantly going through this battle of, I've got to work it, but to work it, it hurts. So I don't work it because it hurts, and I slouch and it hurts. So you're constantly in this battle of, if I exercise, I'm in pain, and if I slouch, I'm in pain. The bottom line is you're going to have to, at least at one point in time, realize that pain of working out will be temporary. And once I strengthen the muscles that are weak and I'm maintaining a good posture, that pain goes away. Yet if I constantly am battling with slouching, whether it's in a sitting position, a standing position, or bad posture when I'm laying down, that posture is always going to be triggering muscles that are overworked and fatigued, and they're always going to be cycling and firing and making you more prone to further injury and chronic wear and tear that's going to lead to arthritis and disc degeneration that's only going to complicate the picture the longer you wait to come in and see a chiropractor or a physical therapist, occupational therapist, PT, or a regular MD, and a lot of times it is just, I've got to buckle down and I've got to work on this. The other thing that you're going to need to work on in a wellness-oriented lifestyle is you always got to be monitoring your thoughts and what is your current attitude in terms of the state of yourself, your relationship with people, the state of the world around you, your job. You know, I hate to say it, but nothing has any meaning than the meaning that you choose to give it. So you can totally change your world by changing the meaning that you are giving to things. You know, I have the potential of bringing my nephew on into the practice. And I have been looking forward to him joining the practice for the last 3.5 years. At this stage of the game, I recently had a conversation with him because he's graduating at the end of this week. I'm sitting there going, okay, what's going to be happening and how fast are we going to be adding on? What do we got to do? This, that, and the other thing. Well, I come to find out he's had an externship with a doctor in Wisconsin who's taught him and told him ways to practice that are a little bit different than me. But it's something that's intriguing to Michael. Michael also would be living 2.5 hours away from where his parents are. So at this stage of the game, does he want to have an environment where he's living closer to home with mom and dad and his siblings? Does he want to adopt the wellness way of chiropractic? Does he want to give everything up and come into my office and do chiropractic a little bit more my way? And then when I finally retire in 13, 14, 15, 16 years, he buys me out and then brings in the practice of his dreams? Or is it something we work for and incorporate? So where I was all set to bring Michael in March, okay, now it might not be happening. He might want to go down to South Jersey. He might want to stay out in the Midwest and possibly go with a wellness way doctor in Wisconsin, Illinois, Minnesota, somewhere out in that area. So he's got some decisions to make. I could sit there and go, oh, I've been waiting for 3.5 years and I can have a pity party, or I can say, you know, Michael, it is your life, it will be your practice, and you've got to do the things that you want to do. And as your uncle, I'm there to support you 110% in whatever direction you want to go. You want to come into my practice? I'm more than willing to have you here. Have a great experience. I'll teach you a lot. You'll grow, you'll flourish, you'll have a great time just as I've had here up at Schooley's Mountain. But if you really want to be closer to home, just as when I got out of school, I had a cousin in Connecticut and we had talked a little bit, but during the course of the schooling, my brother was killed in a car accident. And one time when I was home, I just popped in to see a chiropractor to see how he was doing things. He liked me, I liked him. He gave me an offer on a job while I was still 8 months out from graduating from school. Just as my uncle, my cousin supported me, I'm going to support Michael. So I'm not getting my head wrapped around, oh, why, me, but I'm now being excited because this might not be the right opportunity for Michael, and it might give me the opportunity to bring somebody in that might even be better than Michael, although I find that hard to believe at the moment. But I'm leaving myself open to change. I'm not fearing that something might not be happening that I had anticipated, but I'm already looking for, if it happens, it's perfect, it's what we planned for. If not, something better will present itself, and I'm totally okay with however that is. So you have to adopt that same philosophy. My back went out. Okay, so this is a sign and a symptom that something wasn't working right. What do you need to do to relieve it, correct it, and make sure it's never going to happen again? It could be that on an emotional level, okay, you were getting prepped and ready to possibly have a heart attack, and the universe, or the energy of the universe that is out there that binds and connects us, the ultimate wisdom of the universe said, I'm going to give you a back problem, so you have to rest, so that you are not going to push so hard to trigger your heart attack. So in that case, I'm looking at my back went out is a blessing, or I can be looking at it, my back went out, and it's a curse or it's a detriment. So again, you're going to have to develop a lifestyle that says, what is happening? It's a change. And the one thing I can tell you that I've learned from going to seminars and reading self-help books, a master at any particular craft or activity always prefers what occurs. So whether it's good or bad has no meaning other than the meaning that you choose to give it. Ancient Oriental philosophical story about a farmer who has a son, and this son and he work the land and work the farm. Well, one day, okay, they have a horse that shows up, and the horse is a wild horse, and the son goes and starts to try to break the horse and ride the horse. Well, the horse throws the young man and he breaks his leg. Everybody in the town says, what a shame, because now your son is laid up. He can't help you work the farm. The farmer's response is, good or bad, only time will tell. I can't be the judge of what is good or bad in this particular situation. 2 weeks later, well, the kid's got a cast on his leg and he can't go to work for his father. The Chinese army comes through and is conscripting men for the army, to go to war. Well, they see him in a cast and he's no good to them as a warrior. So the son gets to stay home. Okay, so now at this stage of the game, everybody who was saying the broken leg was so bad he can't help you is now saying, oh, what a blessing the broken leg was, because now he's not being called to war. So the ultimate thing is, it's a broken leg. It's a bad back. Nothing is going to have any meaning than the meaning that you choose to give it. So choose to start thinking of things differently. And Wayne Dyer has an expression, when you choose to see things that you are looking at differently, the things you were looking at will start to change. So it's a great model and a metaphor for life. The other thing that you're going to need to do is you're going to have to probably start to adopt chiropractic, just as I have, as one of those things that you do as just a wellness-oriented lifestyle thing. You know, at some point in time, you're only going to be coming in once a week, once every 2 weeks, 3 weeks, or 4 weeks, depending on how well you manage all of those lifestyle stressors. You know, so it's not a large commitment to sometimes just, you know, make it like you're going to the dentist, where the dentist has you come in every 6 months for a checkup. If they see something wrong, they're going to tell you about it and what they need to do is something little, something moderate, something extreme, depends on what they're finding. But once you get involved with a wellness-oriented lifestyle that's first corrective in nature, you're adopting and adding in the exercises that are going to keep you well. You're making the dietary changes that are going to keep you and make you well. The sleep patterns, the posture patterns, the thought patterns, the intermittent regular care that keeps those circuit breakers always functioning, okay, so that the nerve flow to muscle, joint, organ, and gland and skin is always as near 100% as possibly can be, reducing the level of stress, making sure those ligaments are not going to get soft, that you maintain proper posture, proper form, and proper activity, so that coming in periodically is not necessarily that much of a big deal. And if we find something that's wrong or something that's starting to brew, we can get on top of it right away. And normally, it's only going to take a visit or two to make sure we've got that correction made versus something that gets full-blown because we stopped at relief care. So something, again, to consider. The other thing is we talked about changing and monitoring your thoughts. You know, a lot of times, physical manifestations are the result of what's going on emotionally and mentally within our minds and our thoughts. You know, there's a gentleman by the name of Dr. Sarnow, who wrote a book in the 90s, and his philosophy was that almost every single physical symptom that we have is related to an aberrant or an abnormal emotional thought. And we create the physical symptoms so that the attention is focused on our physical symptoms, so we don't necessarily have to address what is going on with our emotional, mental psyche. So it's kind of like a blocking mechanism or something that says, pull your attention away from what you're worried about or what you're thinking about, and let's deal about something physical. So we just had a phone call where somebody was saying, you know, I'm having an upper respiratory tract thing going on. Does Dr. Jeff still want me to come into the office? And I told my staff, absolutely. And then the other thing I told them, which they did not do, that's my job because I'm the doctor, is to let the patient know when you're dealing with upper respiratory, that is signs of mental confusion, okay? And I happen to know this patient. He's a great guy. But again, in his world and what he's employed with, he has the same trouble that every other employer is having right now, a lack of having consistently stable employees. So I know he's crazed and confused and stressed out about what's going on, who's showing up for work today, who's going to be doing what job within the office. And so it doesn't surprise me that with the mental confusion that's going on in his world, that he developed the physical symptoms of an upper respiratory. So what are we going to do for him? We're going to get him adjusted. We're going to check his cranium. We're going to check the drainage and the immune points. We'll adjust the upper cervical spine, the mid to lower thoracic spine. We'll check the immune system points. We'll check the digestion points, make sure everything is working. Utilize a little bit of some cold laser therapy so that we improve and decrease the swelling and inflammation of the sinuses and improve the drainage out of his head and neck so that everything in that system is functioning properly. I'll also address to him that maybe we need to start thinking about what's going on in our head, mentally and emotionally, and is there states of confusion that are going on right now that are possibly contributing for him to developing these symptoms. Now, to the degree that he's going to say, no, there's nothing going on that's got me mentally confused, I've got everything handled in control, then he probably just picks something up. But on the state that he gives me a litany of things that are going on that create mental and emotional confusion for him, then we're going to have to find a way to help him recognize that, and what are some of the things that he can do to try to get that mental and emotional confusion or anxiety under control so that he now is less likely to have the environment for the respiratory bugs that created the infection to go out and have their party that creates a whole bunch of more new baby bugs that bring down his immune system, have them have this upper respiratory infection. You know, one of the things I can tell you, again, if somebody comes in with a shoulder injury, shoulder injuries generally are a result of nurturing issues, whether you weren't nurtured or you need to be nurturing, okay? The neck comes from, again, not being supported by those people that you care the most about, okay? Or an overwhelming sense of guilt, okay? You can end up having lung issues, Okay, and again, this is the time of year where we're dealing with colds, flus, RSV. There's still some COVID floating around out there that will be impacting the lung. Well, the lung issues and issues around the lungs start and stays with things of being massively angry about things. So, in this environment with everything that's going on, from the political scene to the geopolitical scene to things that are going on economically with inflation, you name it, there's a lot of room for us to be angry about a lot of different things. If that anger is getting out of control, it may be having an impact of what's going on with your lungs. Okay, things that are going on with the urinary tract system generally come down to not far off from being totally angry, but it's generally, pardon my language for saying it, was being pissed off at someone or something. Lower back pain with sciatica typically resolves around financial issues. And with 67% of the country living paycheck to paycheck to paycheck, according to the statistics, it would not be unusual for somebody that's under a little bit of economic turmoil to notice that they've got some lower back pain or sciatic issues going on. So again, whether you're dealing with a physical stressor, a biochemical stressor, or an emotional stressor, or a little combination of all of these things, it overloads your body's ability to adapt and accommodate to the change that is going around in your environment. And as a result, there are specific vertebrae, specific muscles that may be shutting down that are going to require care and attention. And if all I do is remove your symptomatology, but we don't address these underlying deeper issues, more than likely the problem will keep coming back and keep coming back and keep coming back. And ultimately, over time, the more these symptoms come back without the total resolution that you and I are anticipating, oftentimes as the patient, you get rather frustrated. And you will then end up blaming chiropractic or blaming the doctor, myself, for not fully investigating enough or doing enough, or just that chiropractic in general doesn't work. And the problem is somebody's opted for relief care versus something that is more corrective or wellness-oriented lifestyle. It means that we have to create a paradigm shift, and we have to get away from symptom-oriented healthcare, which is what is practiced by the medical profession. And that is really, truly nothing more than sick care. Because you need to get sick, you need to have a symptom for you to enter their world, to give you a pill, potion, lotion, or do something surgically that is going to alter your body forever. Versus looking at is, what is the wellness paradigm that I can adopt into my life? What is the benefit of regular exercise? The benefit of a regularly great diet or nutritional supplementation? What is the benefit from getting the sleep that I need so that I have the energy? What is the benefit from saying no to my devices and yes to a book or yes to just more sleep? Okay, what is the benefit for me to consciously be thinking about how am I going to think and react to things mentally and emotionally versus having my programmed buttons pushed by what the media is telling me? What is the benefit of regular getting adjusted? What is the benefit of regular constant education as to how your body works? And what are the things that you can do proactively versus always being reactive? So these are some of the things I need you to start to consider when you are recognizing that there's a particular symptom going on in my life. It has a particular pattern that is occurring. Is it something that is now chronic in nature? And is it due to something that is more physical, emotional, biochemical, or a little bit of both, or a little bit of all, rather? And if you're starting to recognize that what you have been doing hasn't working, and you're interested in doing something that's totally different, I would recommend that you look into and try to find a wellness-oriented chiropractor, such as we are here at Schooley's Mountain Chiropractic Center, who can start to try to work with you on a very basic level at first. And again, when I say basic, it is, let's address your symptoms, and then let's slowly build one thing at a time. Because I've learned that if I give you, you're coming in with a particular problem, and I give you on the initial visit, here's 17, 20, 30 different things that you can do to make your life better, you are going to be totally overwhelmed, and you're going to say, I can't do this because it's too many things at once. But what I have learned is if we can start to get your symptoms a little bit resolved, start to work on adding in some small, steady, progressive exercises that build from a little bit to a little bit more to a little bit more to a little bit more to a little bit bit more, you're going to find that you easily carve time out to make that, and you eliminate one small thing and add in an exercise, eliminate another small thing and add in an exercise, and little by little your priorities start to shift. And then we start to focus a little bit on the nutritional aspect. That might be just drinking the proper amount of water and starting to shave off a little caffeine or refined sugars in sodas or alcohol. And I'm never going to tell you to stop and go cold turkey. That's your choice. But at least you can start to reduce on one thing and start to improve on something that's going to have a little bit more of a positive benefit. Over time, these will become new habits that are well established. As they are then well established, they become part of your daily routine, and it's no longer an inconvenience. It does not create a pain or emotional stress or strain to be adding and doing these things in, because you've now incorporated the activity and start to live with the benefit. And then all of that bad stuff starts to go away, makes things a little bit easier. And then as we're going through and things are getting corrected, we start again. We continue to talk more about what is the wellness-oriented pattern and what are the wellness-oriented things. You know, it's like the TV commercial. It would be wonderful if we could eat one piece of broccoli and we're healthy forever. We could do one push-up and we're physically strong forever. But the body doesn't work that way. It needs consistency and regularity with everything that we've talked about, from exercise to diet to sleep to posture, to attitude, to getting adjusted, getting a massage, whatever it is that you want to do that's wellness and health oriented, there has to be a pattern of consistency and regularity with that. And if you're ready to take that journey, we're ready to help you or help guide you in the right direction. So if you've seen anything that you've liked in this video, please do me a favor, hit the like button, hit subscribe, and send that along to friends and family so that they can also get a better understanding of what it is to come into a chiropractic office that is wellness oriented. It will address the problems of getting relief care. It will address the issues of making things more corrected so it's less likely to return. And it'll address the issues of long-term wellness so that you can do whatever you want, wherever you want, whenever you want, with whomever you want, as often as you want, is my definition of what it is to be truly healthy and well, and not being riddled with symptoms that keep you from doing things. Now, perfect example is I'm 63 years old. I just got back from Florida. I just did the Beast, 13.1 miles, 33 obstacles. I hit 32 of them. I did it in 4 hours and 24 minutes. I beat oh my gosh, 77% of the competition. So again, I've adopted a wellness-oriented lifestyle, and it now allows me at 63 to do things that I love to do. To play with my grandchildren, to do things with my wife and my children, to do things out in the yard and in with the house. So again, if this interests you, Schooley's Mountain Chiropractic Center is your leader in alternative healthcare. Hit like, hit subscribe, visit our website, smcc4u.com, share with friends and family, because I would love to have this wellness revolution, this 100-year lifestyle grow so that it encompasses and reaches more and more people than just 12 to 14% of the population. If we can get that number to 70, 80, 90% of the population, disease and infirmity and ill health goes away. And it is amazing what the health and wealth of a nation will be like when we have that much percentage of the population doing the things that are wellness oriented. So thanks for your attention. I'm sorry it's probably a little bit long-winded today, but I'm sure this is about a 40-minute video. Hopefully you'll stick to it at the end. You'll get a lot out of it, and please send me some comments as to your thoughts on what we've talked about today. Love to hear from you. Dr. Jeff Culbert, Schooley's Mountain Chiropractic Center, saying have a great rest of your Tuesday.